What if one insulin could provide both long-lasting blood sugar control and mealtime glucose coverage in a single injection? Today in PharmaFlix, we are discussing Ryzodeg, one of the most advanced combination insulin therapies used in diabetes management. We will explain how Ryzodeg works, its uses, dosage, benefits, side effects, injection timing, precautions, and the most important mistakes patients should avoid. And make sure you watch until the end because many diabetes patients use insulin incorrectly without even realizing it, and that can become dangerous. So let's begin. What is Ryzodeg? Ryzodeg is a modern combination insulin used for diabetes management. It contains two different types of insulin in one injection. 70% insulin degludec, which is an ultra-long-acting basal insulin, and 30% insulin aspart, which is a rapid-acting mealtime insulin. This unique combination helps control blood sugar both between meals and after meals. Ryzodeg is manufactured by Novo Nordisk and is commonly available in FlexTouch pen form for easier administration. Unlike traditional insulin regimens where patients may require separate basal and rapid insulin injections, Ryzodeg combines both actions into one formulation, simplifying therapy for many patients. Understanding diabetes. Before understanding Ryzodeg, it is important to understand diabetes itself. Diabetes mellitus is a chronic disease in which blood glucose levels become abnormally high. Normally, the pancreas produces insulin, a hormone that allows glucose to enter body cells and provide energy. But in diabetes, either the body does not produce enough insulin, or the body becomes resistant to insulin. As a result, glucose remains in the bloodstream and blood sugar levels rise. Over time, uncontrolled diabetes can damage the eyes, kidneys, nerves, heart, blood vessels, and even the brain. There are two major types of diabetes. Type 1 diabetes occurs when the immune system destroys pancreatic beta cells, causing little or no insulin production. These patients require lifelong insulin therapy. Type 2 diabetes occurs due to insulin resistance and gradual pancreatic failure. Initially, the body still produces insulin, but eventually insulin production decreases significantly. Why Ryzodeg is different. Most insulin products provide either basal insulin coverage or rapid mealtime control. But Ryzodeg combines both actions together. This means the patient receives background insulin coverage throughout the day and night, plus rapid glucose control after meals. This dual mechanism helps improve overall glycemic stability. For many patients, this may reduce the number of daily injections and simplify diabetes management. And for patients who struggle with complicated insulin schedules, Ryzodeg may improve adherence to therapy. Mechanism of action. Now let's understand how Ryzodeg actually works inside the body. The first component is insulin degludec. Insulin degludec is an ultra-long-acting insulin analog. After injection beneath the skin, it forms multi-hexamers that slowly release insulin into the bloodstream over time. This creates stable and continuous basal insulin coverage for more than 42 hours. That is one reason why insulin degludec is considered one of the longest-acting insulin analogs available today. The second component is insulin aspart. Insulin aspart is a rapid-acting insulin analog. It is absorbed quickly after injection and helps control blood sugar spikes that occur after meals. Together, these two components provide both fasting glucose control and post-meal glucose management. Ryzodeg lowers blood glucose by increasing glucose uptake into muscle and fat tissue, reducing glucose production by the liver, suppressing fat breakdown, and supporting normal carbohydrate metabolism. How fast does Ryzodeg work? The rapid-acting insulin aspart component begins working quickly after injection. This helps manage meal-related blood sugar rises. Meanwhile, the insulin degludec component provides stable background insulin coverage throughout the day and night. Because of its ultra-long duration, Ryzodeg helps reduce glucose fluctuations and maintain fasting blood sugar stability. Who uses Ryzodeg? Ryzodeg is used for improving glycemic control in adults with diabetes mellitus. It may be prescribed for type 1 diabetes and type 2 diabetes. However, treatment plans vary from patient to patient. Some patients may require separate basal bolus regimens, while others may benefit from combination insulin therapy like Ryzodeg. The decision depends on multiple factors including blood sugar patterns, meal habits, lifestyle, body weight, and insulin requirements. Basal versus bolus insulin. To properly understand Ryzodeg, you must understand the difference between basal insulin and bolus insulin. Basal insulin is background insulin. It works continuously to control blood sugar between meals and during sleep. Bolus insulin is mealtime insulin. It controls blood sugar spikes after eating. Ryzodeg combines both concepts in one injection. That is what makes it unique. Dosage of Ryzodeg. Ryzodeg dosage is always individualized. There is no universal dose suitable for everyone. Doctors calculate doses based on body weight, blood glucose levels, meal patterns, physical activity, kidney function, liver function, and insulin sensitivity. Some patients may use Ryzodeg once daily. Others may require twice daily administration. It is commonly injected with the main meal of the day. Patients must never change their insulin dose without medical advice. Incorrect insulin dosing may lead to severe hypoglycemia or uncontrolled hyperglycemia. How to inject Ryzodeg. Correct injection technique is extremely important. Ryzodeg is injected subcutaneously into areas such as the abdomen, upper arm, or thigh. Injection sites should always be rotated. Repeated injections into the same location may cause fatty tissue changes known as lipodystrophy. This can interfere with insulin absorption and blood sugar control. Before injection, patients should inspect the insulin carefully. The solution should appear clear and colorless. Never use insulin if particles or discoloration are present. A new sterile needle should be attached before every injection. The pen should then be primed according to manufacturer instructions. After dialing the prescribed dose, the injection is administered beneath the skin. Patients should hold the needle in place for several seconds after injection to ensure full dose delivery. Used needles must be discarded safely in a sharps container. Storage conditions. Proper insulin storage is essential. Unopened Ryzodeg pens should be stored in the refrigerator between 2 and 8 degrees Celsius. Do not freeze insulin. Frozen insulin must never be used. Pens currently in use may usually be stored at room temperature according to manufacturer guidelines. Insulin should always be protected from heat, direct sunlight, and extreme temperatures. Improper storage may reduce insulin effectiveness. Side effects of Ryzodeg. Like all insulin therapies, Ryzodeg may cause side effects. The most common and most important side effect is hypoglycemia. Hypoglycemia means dangerously low blood sugar levels. Symptoms may include sweating, shakiness, hunger, dizziness, palpitations, blurred vision, confusion, and weakness. Severe hypoglycemia may cause seizures, unconsciousness, coma, or even death if untreated. Other possible side effects include weight gain, injection site reactions, swelling, rash, and itching. Some patients may also experience lipodystrophy due to repeated injections in the same location. Serious warnings. Although Ryzodeg is highly effective, there are several important warnings patients must understand. First is severe hypoglycemia. This is the most dangerous complication of insulin therapy. Skipping meals after insulin injection can increase hypoglycemia risk significantly. Second is hypokalemia. Insulin drives potassium into cells and may reduce blood potassium levels. Severe hypokalemia can cause dangerous heart rhythm problems. Third is allergic reactions. Although rare, some patients may develop severe hypersensitivity reactions, including anaphylaxis. Symptoms may include difficulty breathing, swelling, skin rash, and severe dizziness. Immediate medical attention is required in such situations. Who should not use Ryzodeg? Ryzodeg should not be used during episodes of active hypoglycemia. It should also not be used in patients who are allergic to insulin degludec, insulin aspart, or any component of the formulation. Patients should always consult qualified healthcare professionals before starting insulin therapy. Drug interactions. Many medications may affect insulin therapy. Some drugs increase hypoglycemia risk, including sulfonylureas, alcohol, ACE inhibitors, and salicylates. Other medications may increase blood sugar levels and reduce insulin effectiveness, including corticosteroids, thiazide diuretics, and sympathomimetic drugs. Beta blockers may mask symptoms of hypoglycemia, making recognition more difficult. Special populations. Extra caution is required in elderly patients because they often have reduced kidney function, higher hypoglycemia risk, and multiple medical conditions. Patients with kidney disease or liver disease may require insulin dose adjustments because insulin metabolism changes in these conditions. Pregnancy and diabetes. Good glucose control during pregnancy is extremely important. Poor diabetes control increases the risk of congenital abnormalities, pregnancy complications, large baby size, and neonatal complications. Insulin requirements may change significantly during pregnancy. Pregnant patients should always remain under close medical supervision. Importance of blood glucose monitoring. Even with advanced insulin therapy, blood glucose monitoring remains essential. Patients should regularly monitor fasting blood sugar, post-meal glucose levels, and HbA1c. HbA1c reflects average blood sugar levels over approximately 3 months. This helps doctors evaluate long-term diabetes control. Common mistakes patients make. Many diabetes patients unintentionally make dangerous insulin mistakes. Some common errors include skipping meals after injection, incorrect dose selection, improper storage, using expired insulin, needle reuse, and injecting repeatedly into the same location. These mistakes may cause poor glucose control or severe complications. That is why patient education is critically important. Hypoglycemia management. Patients using insulin must know how to manage low blood sugar emergencies. Mild hypoglycemia can often be treated with fast-acting carbohydrates such as glucose tablets, fruit juice, or regular soda. The 15-15 rule is commonly used. Consume 15 grams of carbohydrates and recheck blood sugar after 15 minutes. Severe hypoglycemia may require glucagon injection or emergency medical treatment. Advantages of Ryzodeg. Ryzodeg offers several advantages for selected patients. These may include simplified insulin therapy, combined basal and mealtime coverage, reduced injection burden, stable fasting glucose control, and convenient FlexTouch pen administration. For many patients, simplified treatment improves adherence and consistency. Limitations of Ryzodeg. Despite its benefits, Ryzodeg also has limitations. Some patients require more flexible mealtime insulin adjustments that separate basal bolus therapy can provide. Others may still experience hypoglycemia or variable glucose control. Insulin therapy must always be individualized. Insulin works best when combined with healthy lifestyle habits. Patients should focus on balanced nutrition, regular physical activity, weight management, adequate sleep, stress control, and smoking cessation. Even the best insulin cannot fully compensate for poor lifestyle habits. Future of diabetes management. Diabetes treatment continues evolving rapidly. Modern medicine is introducing continuous glucose monitoring systems, smart insulin pens, artificial pancreas technologies, and advanced insulin analogs. However, patient education remains one of the most important factors in successful diabetes management. Ryzodeg is an advanced combination insulin therapy that provides both ultra-long-acting basal insulin coverage and rapid mealtime glucose control in a single formulation. Its combination of insulin degludec and insulin aspart helps many patients achieve better glycemic stability while simplifying diabetes management. But safe insulin use requires correct dosing, proper injection technique, regular blood sugar monitoring, healthy lifestyle habits, and ongoing medical supervision. Understanding insulin therapy properly can significantly reduce diabetes complications and improve quality of life. And that is why education remains one of the most powerful tools in diabetes care. Thank you for watching PharmaFlix. If you found this educational review helpful, support the channel and continue learning with more professional medical and pharmacology content. Disclaimer: this educational content is intended for informational purposes only and should not replace professional medical advice, diagnosis, or treatment. Patients should always consult qualified healthcare professionals before starting, stopping, or changing any medication or diabetes treatment plan.